Hi guys, I'm Abdullah Abdul Kareem. I'm from Hyderabad, India, and I have low vision due to retinopathy of prematurity or ROP. So ROP basically is a disease of the retina. The retina is the back part of the eye. It is the light sensitive region of the eye. So ROP affects the retina by causing irregular blood vessel development in the retina. This happens in premature babies and babies who are born with low weight. So I was born at 26 weeks and I weighed just 650 grams. So ROP detection is very important and it helps in preventing low vision and blindness. So ROP detection under 1 month of birth can help a lot of babies to not get blind basically, and it helps restore their vision. So I did not talk about this before. So how does ROP lead to blindness eventually? So I told about the irregular blood vessel development, right? So that eventually causes retinal detachment. That means the retina and the blood supply separate from each other and the retina cells die. So when the retina cells die, that leads to blindness. So in India, ROP is one of the leading causes of blindness in babies. So in my case, I think I had laser surgery after 2 months, and whatever vision they could save, they were able to save, they saved. So I have low vision in my right eye and I do not have any vision in my left eye. So the present treatments of ROP available are, right now there is laser surgery and there are injections as well, which stop the irregular blood vessel development. So when I was born, at that time the injections were not available, I think, but now injections are available. Basically, I am not a medical professional, so if you need any medical related advice, you should definitely go see a retina specialist or an ROP specialist. ROP has many stages, so the sooner you detect it, the better. So complete vision can be restored depending on the stage of ROP. So the later the stage, the more advanced the stage, the more difficult it is for vision to be restored. So that's the thing. And also, when you are an adult, when you grow up, that time you cannot do anything. When, like, after a particular stage, you can't do anything about it because most diseases of the retina cannot be cured. So like you might have heard about how people with corneal diseases, like their blindness was cured or stuff like that, but that doesn't work with the retina. Okay, so now I want to talk about how ROP affects my day-to-day life, right? So how much vision do I have basically? So I have 20/200 vision maximum. Okay, so I'll explain that if people don't understand it. So I just break that down into simpler terms. So 20/200 is like a measure in like the Stellen chart. Basically, like when you go to the eye doctor, you look at the chart and then they tell you to read and all that, right? So they measure the vision by that. So let's give an analogy, right? So there is a tree, okay? There is a tree 200 feet away. So people with 20/20 vision, right? They can see the tree from 200 feet away. But I need to be 20 feet near that tree to see it clearly. I'm not saying I won't be able to see the tree at all from 200 feet, but it would be not very clear. So how do I explain that? Like, it's very difficult to explain, you know. So how do I explain that? So basically, if someone is walking, right, and they're really far away from me, I don't know who they are. I can see them, but I don't know who they are. If they come closer to me and if they're like near me, then I know, oh, this person is so and so, right? And it affects in seeing stuff which is far away as well, like reading stuff. So reading signs on the boards, reading signs on buildings, basically reading all the things which are far away. So either I need to zoom with my phone or I need to be very close to it to see it and so on. So I use writing and I go very close to the paper when I write. I go very close to the laptop when I see the laptop. I use my phone very close to my face and so on. So it affects every aspect of my life. I wanted to talk a little more about some things. So the irregular blood vessel development in the retina mostly, in most of the times, is caused because of excess oxygen. So when the baby is premature, they may have other difficulties like breathing and so on. So they are put in an incubator and oxygen therapy is given. Sometimes that oxygen or excess oxygen triggers the irregular blood vessel development of the retina and it triggers ROP basically. So that's one thing. Also, in the initial stages of ROP, you really cannot see the difference. Like when you look at the baby's eyes, you won't know that the baby has ROP. So that's why it is very important in the initial days, like within 20 to 30 days of birth, that an ROP specialist looks at the retina of the baby. Otherwise, you will not know that the baby has retina. There's no physical symptoms, there's no redness, there's no watering, there's nothing. So it's better that you detect it early. Otherwise, it might not be possible that the vision might be completely restored. So, more things I want to talk about is that I did talk about my struggles with having low vision, but that doesn't mean that people with low vision cannot do anything, you know. That is a very horrible and bad assumption. So just to give an example, right now I have just started doing my PhD in biological sciences at the Indian Institute of Science Education and Research, IISER Bhopal. So I think that's proof enough, right? So we need more people with visual impairment and low vision and other disabilities in science streams and so on, but there is so much accessibility and other barriers. That's a different topic. We can talk about that later. But the point is that people with low vision and blindness are very capable. So it doesn't really matter that my laser surgery was not completely, it couldn't completely restore my vision. I still have enough vision, so I can walk independently. I don't need a cane. So I have enough vision that I do not need other mobility aids. But people with lower vision definitely do need such things. So that's the thing. So it depends, right? So I, like, for example, studying in classes and so on. So I use a telescope. Basically, it's a monocular. You like put it on your eye and you can see the board and all that. But then the visual field of that is very low. So that also affects the things. Like you can only see a limited portion of the board and all that. But then you can be very successful even with low vision. You can do a lot of things. So that, like, just because I need certain accommodations and maybe a little increased font and I need to go close to the screen and so on, that really does not mean that I am not capable. So basically, people with low vision and blindness, people who are even completely blind, I know so many YouTubers that they are really successful. They do a lot of sports. There are people who play like blind and visually impaired sports. There are blind surfers, there are blind accessibility and awareness and accommodation and those kind of people, and then there's blind influencers and like people who do skating, and then there's people who do so many things, and that's really awesome and amazing. They're just living their best possible life. So the point is that disability is not a bad thing. Low vision, blindness is not a bad thing, but if you can prevent that disability, prevent that low vision, prevent that blindness before it happens, that makes the person's life very, like, more easy basically, because this world is definitely not designed for people with disabilities, because this world is very ableist, and that is a fact. One important reminder is that visual impairment and blindness is a spectrum. Every person has a different kind of vision. Every person has a different level of vision, and no two people with the same condition have the same amount of vision and so on, right? So it's a spectrum. So you do not assume things. If you want to ask something, you ask it kindly and gently, and don't have assumptions. So people with visual impairment and low vision and blindness and any other disabilities, they can do a lot of things which you think they can't, but they really can do a lot of things, and they are really good at breaking stereotypes. They're very good problem solvers, and it's not good to assume things, right? So that's my message. I hope you really like this video. This might not be the best video, but then I just made it to spread awareness and disability awareness, accommodations, accessibility, advocacy, all of that really matters. So I hope you liked it, and yeah, that's it. Bye.